Hi, my name is Dennis Acosta, and this is my indwelling catheter checkoff. So first thing I want to do before I go into the room is verify the provider's orders, which I have a paper chart here. And I want to go ahead and double check the allergies. All right. So I'm going to go ahead and face you towards the patient before I go into the room. All right. So first thing I'm going to do is I'm going to go ahead and knock on the door. I'm going to foam in, introduce myself. Hi, my name is Dennis. I'm a student nurse. I'm here to insert a indwelling catheter. Can I please get your full name and date of birth? Okay, I'm going to double check that on the paper chart as well as the wristband. And then do you have any allergies? And if you do, what are your reactions? I'm going to go ahead and check that on the paper chart as well as the armband that it matches. So as I mentioned earlier, performing an indwelling catheter, basically sticking a tube into your urethra all the way up to the bladder. That way you can void. Um, it's it's an order by your provider. Do you have any questions or anything on the procedure? No? Okay. So next thing I want to do is go ahead and provide patient privacy. I'm going to close the curtain. I'm going to make sure, put the bed in the lowest position. I have two side rails up. Bed is locked. Patient has call light within reach. And I see no clutter or anything like that where the patient can go ahead and get hurt. Once I do that, I want to go ahead and gather my materials. So here I have my new catheter kit. I have a pair of clean gloves, I have my hand sanitizer, and I also have my tape for securing the catheter. All right. Next thing I want to go ahead and do is I want to ask the patient if they have a history of um, a urethral stricture or if they've ever had difficulty with catheter insertion in the past. Patient states no. Okay, so I want to go ahead and I'm going to perform hand hygiene. Okay. I want to raise bed to to a good working position. Apply my clean gloves. All right. Now I'm going to go ahead and place this back. Okay, I want to expose the patient. And I'm going to go ahead and drape this over the patient's abdomen and try to provide them a little bit of privacy. Now I want to go ahead and clean the patient with the approved skin cleanser. I want to examine the urinary meatus. If the patient was circumcised, I would go ahead and pull the foreskin back, clean around it, make sure it's good and clean, and now I'm going to dry the patient. Now I'm going to go ahead and, since I did pretty much just did the cleaning, I'm going to go ahead and pull these gloves off since they are dirty. Place them in my garbage right there. Okay, I'm going to go ahead and perform hand hygiene. All right. Okay, now my hands are dry. I'm going to go ahead and open this up. I'm going to use this as a garbage bag. I'll place it at the end of my table. Now I want to go ahead and, right, I'm going to go ahead and open this. Maintain sterility. I don't want to touch the inside of my sterile field because that is clean. All right, so I'm going to go ahead and pull that this way. Now I'm going to pull this way. I'm just going to go ahead and put my computer back a little bit. Okay. All right, now I want to go ahead and grab the inside of my blue sterile field. I'm going to shake it out and grab the outer 1 inch and the waterproof part and place it down. Okay, this is here. I'll go ahead and fix it later. So I'm going to go ahead and grab my gloves now. Sure not to sterilize or unsterilize anything else. Place this down. Right. Now I want to grab the inside of my glove. Go ahead and put this on. Perfect. Let that go. Now I want to grab the inner cuff. Go ahead and slide it up. Perfect. So now that I'm sterile, I can go ahead and fix this. All right. Now I want to go ahead and grab, this drape. Fenestrate drape. Does have a tear on it from the previous try, so go ahead and place this over. Okay. Now it's good. Now I want to go ahead and take this out here. All right, so I have my jelly. I'm going to go ahead and open this up, put the jelly into the slot, pour it in there, go ahead and toss it. Now I want to go ahead and soak the cotton balls. I'm going to go ahead and place it all over the cotton balls, soak them, toss this. Next thing I want to do is check out my catheter. I want to make sure it's clamped, which it is. All right, now I am going to go ahead and take off the sheath. I'm going to wrap it around my fingers so it doesn't go anywhere. Toss this. Then I'm going to go ahead and place this into where the lubricant is, so it stays in place and doesn't get contaminated anywhere. Now what I want to go ahead and do is I am going to go ahead and grab my injection. I'm going to go ahead and uncap it. Then I am going to go ahead and put it in here. Okay, have it ready. So I'm just going to leave it right there. Next thing I want to go ahead and do is I'm going to go grab the penis and pull it out of here. Now since I do have it on there, I can't touch anything else because it's now unsterile. So now I'm going to grab my forceps. I'm going to grab my soaked gauze. I'm going to clean from the inside out. So that's one. Okay, I'm going to do it again. Okay. Again, clean from the inside out area. And I can go ahead and, use another one to clean a little further around just to be sure it's good. Clean that. Now what I want to do is go ahead and grab the catheter. Okay, I'm going to go ahead and slide it in. I'm going to hold this up at a 90-degree angle. Okay. Okay, and since I am using a towel, it's a little bit hard, so I'm just going to go around through the back. Obviously, I wouldn't do this in real life, but I'll just pull the catheter through. Okay. So I'll just go back to where I was. So, being that I never, technically touched the penis with my hands, since this is sterile, I'm going to continue feeding it through all the way until I get to the bifurcation. So again, let me just go ahead and pull it all the way through to make it easy. Okay, so I'm here at the Y. Now what I want to go ahead and do is I want to go ahead and insert. Okay. Okay, now that I've inserted it, I'm going to go ahead and disconnect it. Throw this in here. Okay, now that I have it in, I'm going to go ahead and pull out gently. Okay. Now that I feel resistance, I'm going to go ahead and stop. All right, I'm going to go ahead and pull this out. Got this here. Move it. All right, I want to go ahead and tape. So I want to make sure there's a little bit of slack on here. So say it stops here. That way it doesn't pull and hurt the patient, cause any trauma. And obviously when I was putting it in, I wanted to go until I got to the bifurcation, but I would notice when the urine was coming out. All right. Next thing I'm going to go ahead and do is I'm going to secure this to the side of the bed. Okay. So now that's out. Let's go ahead and clean up all my supplies. Okay, I'm going to examine the patient. I'm going to look at the urine that came out. I'll look at the color, the clarity of the urine, check out anything else that I might see. Assess for drainage. I'm going to clean up the area. I'm going to provide a hygiene to it. Got my gloves. Once everything is good, I'm going to ask the patient if they're comfortable. Ask them about, how they feel. Once everything is good, go ahead and re-drape the patient. All right. Take off my gloves. Okay, I'm going to lower the patient back all the way down to the lowest position. Okay, back to the lowest position. I am going to make sure the bed is locked, make sure they have call light and reach, no clutter anywhere, everything's cleaned up. I'm going to sanitize my hands. I'm going to document that it's been done. And that is the end of my checkoff.